Hello, friends. So, today we are going to discuss seasonal flu. Seasonal flu, we are going to discuss this topic in headings of first introduction, then some epidemiology, then mode of spread. Finally, we'll address some special population, and at the end, we will discuss some preventive guidelines. So, what is seasonal flu? Seasonal flu is nothing but common viral infection which is caused by influenza virus. The influenza virus has many subtypes: influenza A, influenza B. We commonly know these terms by its subtype like H1N1 or H3N2 or H5N7 or so on. The most common being H1N1. So, what is the epidemiology? What is the current involvement of this virus? So, each year it is predicted that it almost involves 45 million patients worldwide, and the incidence of this disease increases as we go higher in the age, right? So, higher in the age means if we consider age group of 45 to 55, almost per lakh population, 4 or 5 individuals will be affected. From 55 to 65, the number goes as high as 20 to 30. And over the age of 65 years, almost per 1 lakh patients, 1 lakh normal individuals, around 220 will be affected with seasonal flu. These are some numbers. So, to give a perspective, as the age increases, the risk of influenza increases. What are the other risk factors? Younger age. So, age group less than 5. So, this is the cutoff. Age group less than 5 and age group more than 65. These are the target population in whom the influenza is more common. Apart from that, the other population which is susceptible to this is immunocompromised host, such as cancer patients, patients who are on corticosteroids, patient having underlying medical conditions such as chronic kidney disease or chronic liver disease or any other diseases which are there, right? So these are the risk factors are which are these are the populations who are susceptible to seasonal flu. Apart from that, how this infection spreads? So this infection spreads by droplet infection, that is air transmission. So a normal person who sneezes, the distance of the virus which can be transmitted, it varies from virus to virus. So influenza virus usually covers a distance of around 10 to 25 meters. So that's quite a huge distance. So coming back to the same step which is we have been reiterating, that hand wash, wear mask, and social distancing. This applies to all the viruses which are there, right? Now, apart from this, what are the special populations we need to take care? Pregnant individuals. So, pregnant females are susceptible to influenza. So, it is recommended that these individuals should receive vaccination, and we will discuss this vaccination topic in details. But before that, I would like to tell you why this influenza keeps on coming every year. Because of the structure of the influenza virus, it has some proteins on the periphery which change its structure every year. So every year a slight change in the protein will lead to a new kind of strain, and this strain will cause new infection. So in past, if we see on last 100 years history, the worst possible pandemic which happened in 1999 and 1920, which was the Spanish flu, nearly one third of population was affected at that time, and around 50 million of patients died due to that infection. So that is the severity of that infection. And then since then, every 10 year we see a pandemic with that, the last being in 2014-15, and maybe somewhere in avian flu was in 2020. So we need to be alert about this seasonal flu. How to prevent this? So the effective way to prevent this is vaccination, and the vaccines which are available, they are having various strains. So the recommended is quadrivalent vaccine which is available in the market, and the vaccine is to be taken every year once before the start of winter, preferably, because temperate climates usually tend to have infection in the winter season. So maybe from August or October till Jan or Feb, this is the susceptible period where we have common flu or common infection. So, in short, if I want to summarize everything in this, influenza is a very common disease. It usually happens during winter season. The signs and symptoms of this are like common cold, headache, body pain, muscle pain. How to address this? We have to take care of special group of population. age group less than 5, age group more than 65, and comorbid individuals like uncontrolled diabetes, uncontrolled hypertension, CKD, CLD, and etc. etc. And prevention will be by vaccination, mask, social distancing, and hand wash. That's all.